Good afternoon or good morning, depending on where you're at. My name is Zach Kunkel, and I am an Associate Product Marketing Manager here at Dude Solutions. Thanks so much for tuning into our presentation, Space Visualization and its Impact on Healthcare and Senior Living Operations. How do you currently visualize your facilities today? Is it through the map in your head, or maybe you take each floor plan out every time you need it? Whether you rely on your memory or drawings to represent your facilities, there's an easier way to map out your facilities, assets, and compliance needs. With modern technology, there are ways to use an operations management system to house digitized representations of your floor plans to enable operational efficiency. So I'm going to kind of run through the roadmap for today. So first off, going to welcome and introduce our speakers. We've got Kyle Adamo, Scott Murray, and John Ganley. Kyle is our Senior Product Manager from Dude, and then John and Scott are actually joining us from First Health of the Carolinas and North Carolina. We're then going to kind of run through the current state of the market and what we have seen as we've done some research on how the healthcare and senior living market stands today. Then Kyle, John, and Scott are going to have a conversation just about their facilities and operations and how they have stored their drawings and done that to date. Then Kyle is going to give us a little snapshot of what space management looks like in the Works Hub. And then last but not least, we're going to have a closing and Q&A section. So a couple housekeeping items. If you haven't noticed by now, your lines are muted. If you do have a question, please utilize the chat or the Q&A feature that you should see on your toolbar for Zoom. At the end, like I said, we will have a chance for Q&A, whether it be for Kyle or for the guys from First Health. So if you do have a question, please submit it through the Q&A feature, again, through the Zoom toolbar. You will be receiving a recording of the presentation within a couple business days. So if for some reason you do have to hop off, or if you do want to see the slides afterwards, don't worry, we will be sending that your way. And then last but not least, we are going to be utilizing the poll feature on Zoom webinars today. So we would greatly encourage you to engage with us. So now, without further ado, I'm going to introduce our speakers today. Like I said, Kyle Adamo is going to be leading us from the Senior Product Manager side. He oversees the Works Hub platform. Kyle brings us 20 years of experience in the healthcare and senior living industry. And during those years, his focus has been around managing and building healthcare operations software. His goal each and every day is to help professionals solve pervasive operational issues within the senior living and healthcare space through software. Next, we have John Ganley, who's the Director of Facility Services at Moore Regional Hospital, which is a part of the First Health of the Carolinas system. John brings us 31 years of overseeing healthcare facilities and 20 years of experience in management and oversight of the environment of care. John's undergone numerous Joint Commission surveys and obtained CMS survey experience with really positive results. Next, we have Scott Murray, who's an AutoCAD life safety draftsman and equipment planner. Scott brings us 13 years of experience with various types of construction management, and the recent 6 years have been focused on life safety drawings. Before his work with First Health, Scott worked at Cape Fear Valley Health System. So without further ado, I'm going to turn it over to Kyle Adamo.
Thanks, Zach. Let me just get set up here. I'll take control. First thing we're going to do for everyone who's on the line and listening, we're going to start a poll. Since we're talking about space management and your architectural drawings and life safety drawings, we're going to do a quick poll. And we've commonly seen people, our clients, with a mix of paper and digital files, various digital formats and software systems that they use to access these drawings. One of the things we want to know with this poll that you'll see on your screen is, do you have all of your architectural and life safety drawings stored in a single place and format so it's easy for people to access? We've often seen all sorts of mixes of formats, and I just want to get a pulse from the people who are participating, what they have, if they've got everything centralized and standardized, or if it's still a bit of a Wild West. So once you get a chance to sort of answer this question, we can look at sharing the results back to see where people stand. I have a suspicion.
Yep, Kyle, we're already getting a lot of responses, so I'll give them 10 more seconds.
Okay.
All right, gonna stop the poll, and then I will actually share the results.
So this is, essentially with this question, we're trying to paint a picture that within most healthcare organizations, the access to these different drawings and artifacts about your space is pretty scattered. Some of them are paper, some of them are digital, some of them are AutoCAD, Revit, some of them are on the wall, rolled up in a tube in a binder. So it's one of the problems that we want to solve with our space management application. And we'll get more into this later, and we'll have a bit of a discussion with the First Health guys about this as well. So thanks for that, Zach. That was a common thing. And for those who've got it all centralized, kudos to you. You're ahead of the curve in that regard. So let's take a quick step forward and look at the current state of healthcare and some of the trends that we're seeing as it involves your space drawings and architectural drawings and life safety drawings. We're seeing a lot of inefficiencies in how these are organized, and not having a centralized repo of all your architectural and life safety drawings. This can lead to a lot of time wasted flipping through binders, returning to the office where they're pinned to the wall, interrupting others to go find the data you're looking for. We can make these all accessible to anyone based on permissions within our system. So that's a huge trend that we're seeing, a problem that's in the industry. And that poll sort of confirms that. There's a big interest in our customers being able to understand how their space is being utilized. For a lot of people, they're being reimbursed based on their space usage, and understanding how much space is allocated to patient care, diagnostics, treatment, or other cost centers can really help you in your reimbursement reporting. So that's a trend we've been looking at. We're trying to come up with solutions to help alleviate some of the problems in that. There's a lot of efficiencies that can be gained through being able to present sort of a visual representation to your staff, whether it be on mobile or through a browser. Having a picture goes a long way. Immediately you can understand where your work is. If we think about the role of a technician, which we'll get into later, they got to get to where the work is, get there efficiently and do that work, and we'll talk a bit about that. But once you put a picture up there where people can sort of wayfind, they become a lot more efficient in that regard. And we really want to democratize access to this data and make sure anyone can access it from anywhere within reason. Obviously, it's logged in, it's behind a login and it's protected, but we want to make sure that anyone, anywhere can access it. So smartphones have become pretty pervasive. Most people in the world have a smartphone. When we look at the people using the Works Hub, whether it be managers or technicians, about 85% of the people who access us daily use a mobile device at some point to access our system. So being able to provide access to these drawings and life safety details anywhere on any device is pretty important to us, and that's a problem that we're trying to solve too. So some of the issues that come up with this is there's this gold mine of data that's built within these drawings. Data that visually represents space is sort of a huge untapped data set, and it's so easily interpreted by almost everyone. You can show someone a picture of a floor and they could immediately get a sense of the building, the scale, where they are, where they need to go. When I look at client drawings myself, things go from pretty vague as to what their building looks like to crystal clear. I can kind of understand where everything is, how to get around, the scale of the building, how it's laid out, how to navigate. It's immediate. And leveraging this data can have a huge impact on your organization. So having this data in multiple formats, difficult to access, not accessible to people, is pretty inconvenient for new staff members or even surveyors. You know, there's a lot of important data tied up in those, and if you can expose it and make sure people have access to it within reason through permissions and whatnot, it becomes a pretty powerful tool. A lot of in our industry, staff turnover is sort of a big issue. And this allows us to have a lot of business continuity across those staff changes. There's less stuff locked up in someone's head. The understanding of the space isn't just on one person or two people. There can be a lot of people have access to this, and as staff changes, onboarding new staff becomes a lot more efficient because you've got this data centralized. And centralization is huge. So that's one of the major goals of building the space management application on the Works Hub, is to give people a place to take all these different artifacts that they've got, get them in one place, and embed it into a daily workflow system that everyone's using on their day-to-day work. Visibility into space utilization across the hospital, this is another big issue that people are having problems with, that we think we can solve, and we've got some solutions that you'll see later on to understand how square footage is allocated to various cost centers or different uses. So that's a big, quick win for a lot of people to be able to get that data out of our system. So why does it matter? So what's the impact going to be on your organization once you get this sort of technology in place? So when we look at the facilities operations, we really want to streamline and simplify the role of the technician. With the immediate power of a visual representation of your buildings, you can really simplify the day-to-day of a technician when they can visualize where their work is, plan the most efficient route to get there, maybe how to avoid John's office or something like that. Just kidding, John. But you can see all of your work on a map, and you can really optimize how you're going to get this. And because we're centralizing it and embedding it in their daily workflow tools, which the Works Hub is, it leads to getting work done faster, which is one of the big benefits here. Because they can see, they can plan their routes, they can see work that's nearby, they can get stuff done faster and get more stuff done, essentially. Likewise, getting new staff up to speed faster. It's a fantastic tool for staff onboarding and helping people get a lay of the land. They need to find a water shutoff, no problem. Just hit the website, turn on that layer to find them. It can really simplify and streamline everything to do with their onboarding, or at least understanding the facility and the layout and how to get around. Similarly, with compliance items and publishing your life safety drawings, you can find your exit lights, fire doors, evacuation routes, med gas shutoffs. It's as simple as clicking a checkbox, so you can really streamline access to this as well, and make sure everyone who's out in the field can access those different data points to know where all those items are. So getting access to documentation or equipment on spaces, it's as simple as clicking on a room on a drawing. You can get your manuals, safety data sheets, pictures, or any sort of linked document or historical document that's tied to a piece of equipment or a location. It's a really quick and easy visual way to get to that data that you're looking for. Understanding how your space is being used and the square footage allocation to each, depending on how your reimbursement calculations work, this can be a big help. It can cut down a lot of time, or at least help you find places where you need to sort of finesse things or to update your data to make sure it's more accurate, because it gives you a very quick visual and graphical representation of how space and square footage allocation is done. Technicians, we want to as best we can, avoid the friction in accessing some of this data, to eliminate return trips to, say, the maintenance office to review plans, or to Scott's office to get access to drawings, or the dreaded email forward where people are trying to find access to information and you just keep forwarding it to the next person who you think might have it. We can help to avoid all that stuff by centralizing it all in one place and making sure the right people have access to it from whatever device they happen to be on. One of the other big problems that we encounter with CMMS has to do with the work requests that are coming in. A large portion of your corrective work comes from in the field from what we call requesters. These could be care staff, these could be anybody within your facility or your organization who needs to submit a corrective work request. Making sure that their request is as accurate as possible, meaning they've picked the right location of work, can be a challenge for some people, but giving them a visual view of the building so they can pick the actual room really helps to ensure accuracy of data and saves a lot of time on clarification requests where you get a request and they've just said it's on the first floor and you need to call them and figure out exactly where on the first floor it is. If they can look at a drawing, they can pick the exact room or corridor or stairwell or wherever it might be and make sure that request is as accurate as possible. So there's a lot of huge impacts to your organization once you start to present your architectural and life safety drawings in a visual way to your users. So let's jump over. We've got a couple partners from our First Health of the Carolinas on the line, and I just wanted to sort of include them in this conversation, so it's not just me. Maybe let's throw to John and Scott. John, maybe you can start by introducing yourself. Tell me what your role is there, and how you work together with Scott.
Yeah, I'm John Ganley. I'm the Director of Facilities. Been with First Health for 10 years. Previously, I did a lot with Environment of Care. I was a safety officer for the system. So really, from a life safety drawing standpoint and a plan drawing standpoint, it really all goes together and really take care of the situation. I've been working with Scott for a few years now. Scott came in as a life safety drawing. We found this was a problem in the past trying to keep up on all our drawings. Scott, did you want to talk?
Yeah, my name's Scott Murray. I've been doing all the life safety drafting, reorganizing of plans, finding plans, creating all our life safety plans for Joint Commission.
So one of the things because we had to have a conversation earlier, everyone who answered no to that poll, where they didn't have a centralized repo of all their docs or in a standardized format, neither does First Health. They're lucky enough to have Scott in place, so they're in a decent position. But maybe you can tell me a bit about the different artifacts that you have around there, Scott, that you're trying to get a handle on.
We have everything from Revit to the old vellum blueprints, you know, the blue and matte paper type thing that we are working on. You know, we got our oldest building is 1928, and it's probably been remodeled several times. So trying to find that valve that may have been moved on this renovation but was not recorded on that renovation, that type of thing. But yes, we have a combination of artifact paper documents all the way to Revit files.
Right. And that's unless you're a brand new build, that's typically common, where people have buildings of different age and pedigree, and they've got different artifacts that go with each. And adopting a space management system that's going to be embedded into your CMMS is typically the kicking off point for a lot of people to get their hands around that and figure out what are we going to do about some of these paper documents or these blueprints, and how are we going to digitize them. So I know we've been working with you guys for a while now. What were you doing before you got on board with the Works Hub for managing your facilities operations? What were you guys doing before?
Previously, we had 3 different type work order systems. We also had one facility with an Excel spreadsheet to keep track of work orders. So when we did look at it, trying to get it all in one place, that's why we came to Dude Solutions, because you guys have worked trying to get it all in one spot. And we're doing this corporately wide because we have roughly 109 locations. Right.
And that can be, so, and this is a common thing that we see a lot of the times when we get into sort of a health system in a sense where they're, or where there's multiple facilities. Sometimes they're on different systems, they have homegrown systems, a different vendor. Then when it comes time for corporate reporting or sort of analytics across the organization, that's where it really hurts, when you're trying to standardize that data and get it all together so you can figure out what's going on. So that's interesting. We're glad to have you on board. So what was it, as far as what sparked looking at the Works Hub as a CMMS, was it mostly that problem of standardizing and getting rid of the various systems that are out there?
One of the things previously in the past when we had to attach a drawing to a work order was many different systems, and it was very hard to do. And with the Works Hub system, we can actually, it's a seamless process. We can just click on it and attach it right away rather than trying to go through another system. Right. And we send technicians out to work. You know, if you give them a print of a room with the wall right down to where you need to work, it saves going back and forth 3 or 4 times to try to get the same job done.
Absolutely. Absolutely. And that's where we see a lot of the time savings, is just those sort of return trips and making sure everyone's got access to what they need. So just, I know we're still in the throes of implementing the space management system there at First Health. It's pretty new. And I just wanted to let everyone know on the phone, the we have a beta program that we work through with our clients. So anytime we're building a new application such as space management, we just don't build it and throw it out there to you. We work with our clients through a beta program. So if we've got some brave souls out there who want to be part of that beta program, they can get early access to stuff, and they work with us to work out the kinks, to sort of smooth it out, to make sure it's solving their business needs. They'll get a say in how the software gets built. So that's one of the things that we pride ourselves on, is making sure that we connect with clients and we get product in their hands early to make sure we're on the right track, so that when it is time to launch it, that it's as good as it can be. And we've heard from the market, and we've worked through a lot of those rough spots. It's not always easy. There's sometimes false starts, and so I know you guys are still in the throw of that. When you look at our space management tool being integrated with our CMMS, what sort of benefits do you see that this will bring to your department or your technicians?
It helps us track what work they're doing and where, because a lot of times when it comes down to looking at future budgets, you know what areas are problems, and it just helps you out all the way, because when we do a lot of reporting, we all do, we have to track how much we're doing.
Absolutely. So with one of the other topics or one of the other features that's in the system is this idea of understanding your space utilization and what square footage is dedicated to each use. How do you think this will impact you, and how's that going to drive decision making at First Health?
Scott, you there?
Yeah, I would. It's going to help us tremendously. I know they're probably working off an old Excel spreadsheet that is not accurate.
Right.
I have not updated anything. I've not been asked to update anything since I've been here.
Right.
I don't know where that information came from.
Right.
So starting it again would be from scratch.
One of the things we're looking at in the future is, and we have talked to Dude Solutions on this, is from a space management standpoint, when you have areas that are unoccupied, you need to know who's the owner of that area, because how many times do you go to move somebody in an office, all of a sudden you open the door and somebody's living there. Space management standpoint, that would really help out, because it would track who is the landlord over that area.
Absolutely. Yeah. Who's the owner of that at this point? Now you have commercial occupancy as well in your buildings?
We have commercial occupancies. We have ambulatory healthcare. We got healthcare. We have dental clinics, fitness centers, EMS bases. We have a lot of stuff here.
Exactly. And it's so having you involved in this at the early stages has really helped us shape the product. And there's even more, like we're in there with software solutions like this, they evolve over time. So we have a roadmap for this as well, and a lot of new functionality that we're going to add as we get going. So excited to get people on board and to have people using it. So when we think about the different roles within your organization at First Health, who do you think will benefit the most from having these drawings accessible to the work sub?
Well, our C-suite upstairs in administration, they can look on and take a look at an area. And even from a director standpoint, you can take and figure out what area of your hospital is a problem. You can go in and take a look. And with the work order system, it does track what areas. I know with this space management tool, you can open up a floor plan and see what work orders are assigned in what areas of that floor.
Absolutely.
So that's what's good about it.
That's some of the stuff we'll look at in a moment.
I think there's one more good point on it, that, you know, the ease of the use of the software and the visualization of the floor plans integrated with the work orders. You know, at first it was a little difficult. We do have an older demographic staff. You know, times are changing to where softwares are taking over how they do their day-to-day life, which was a little bit of a push-pull. But once they got it, you know, yeah, they may not even, you know, some of them just know how to check their email, you know what I mean? Where now they're full-blown, you know, working the software seamlessly. So it's the ease of use and the visualization, I think, are a big part of the software as a whole. So,
and that's
very beneficial.
That topic is one that's, you know, we've been acutely aware of for a while, and it tends to, the topic of sort of the generation gap in the different staff there, especially the technician staff, you know, people who are great at diagnostics and fixing and repair and PM, and then those that are great at technology. And our role as a software provider is to try and bridge that gap. So it's something we're aware of, and we try and build into our design of the systems to make sure it's easy to adopt and is not a burden for people. It needs to be simple so we can get that adoption, make sure people can leverage that data. So, you know, thinking of sort of the early stages of adopting the space management app, what advice would you give to your peers who are considering this decision?
Well, one of the things we talked about is just having somebody that can manipulate your drawings a little bit for when they get downloaded. Because if you make changes, it can be a little cumbersome sometimes, but like I said, it's good for us here having Scott on board because he can go in and manipulate the drawing. But if you had to bring in somebody from the outside, it's good to have a plan ahead of time to do that.
Absolutely. One of the other things that we talked about is making sure that you've got some consistency and a reality check behind how you're naming and numbering your rooms. We've seen a lot of
That's
people.
That's a good one.
We've seen a lot of people, you know, in various industries, you know, they're going to rename this wing after, you know, the Beatles, and we're going to use this numbering system, which just didn't make sense or was sort of a transient decision that got changed. So we need to have everyone on board and sort of standardize how we're naming things so that it corresponds with the drawings to make it easy for everyone. Call things what they are, something that people are used to and everyone agrees upon.
And a kicker to that, you know, is to do the standardization of the drawing naming also. You may have one with a project number on it. You may have with, you know, your internal project number. You may have one with a architect project number. You may have one called, you know, outpatient. You may have one called whatever. So going back through and standardizing all those before you do upload them would solve a lot of problems too.
And I think that based on sort of what we've seen in the poll and what you guys have told me about having sort of these different pieces of information scattered throughout, I think having an inventory of those and knowing what you have on hand and who's the owner of it. So if something's in CAD and they need to go through you, we need to know that. If something's a printed document that's on John's wall, pinned to his wall, we need to know that. We need to basically know where all these things are so we can at least begin the early stages of collecting that information so we can get it into the system. And that first push is usually the most difficult, is let's find all the things that we need. Often one of the things that we've seen is the best to start with is let's start with one building, one that's sort of the most up to date, the most reliable as far as the data goes. Let's get that up and running, and then let's knock off the rest as we go. And if that means getting a digital scan of a blueprint so we can upload it, that's fine. That's what we'll do. But knowing what you've got and what the barriers are to get that uploaded into the system, that's important to know. And I think most people will be in that position where step one is going to be, let's get an inventory of all the different artifacts that we have or data sets that we have.
Correct.
So,
now, would you know, also suggest, you know, we've mentioned the various formats of plans, you know, AutoCAD, Revit, and so on. Naturally, you know, a PDF is probably your basic, you know, the go-to for everybody. So, I'd highly recommend, if you don't have a draftsman, maybe, you know, get a part-time one, something like that, where they can convert those CAD drawings that you may have to PDF. That way they can be uploaded properly.
Yep. And that's it. Eventually we hope to be able to deal with the CAD files directly, but from CAD you can convert to PDF, and that's an easy one for us to work with to get everything uploaded. It's easily shareable and things like that. Everyone can open it and look at it. So that's a good step to get stuff into PDF where possible, and then we can take it from there. So let's, thanks for sharing some of your experiences, guys. I think it's helpful for everyone to hear where you guys are at and where you want to go and what's important to you when it comes to space and your different drawings. Let's take a quick look at the software in action. I'm going to take you through some of the stuff that it does. It's not going to be a live demo. I've got some recordings of screens and stuff that we'll get through. And I just want to give you a taste for what it does and how it's embedded into the Works Hub. One of the things that is sort of paramount to it is just the ability to explore your drawings and understand your space. Obviously, you get a visual layout of your floor plans. You'll see all your room names on there. You simply click on any room that you want. You'll get a flyout. You can get access to pictures. square footage information, any attachments that go with it, files that go with it. You can use this as a jumping off point if you want to go edit or manipulate those locations as well. You can access edit functionality from here. Finding your work orders and finding your way around is another important thing. We can immediately overlay work orders on top of your drawing to see exactly what's out there. If you want to just see open work orders, you can see those. You can get access to details of that work, any images that might go with it. Here's sprinkler heads that are too close to boxes in an area. So you can see all that stuff just by putting a work order overlay on there. It helps you in sort of identifying problem areas or helping you with sort of coordinating your assignments to make sure people are not walking too far between jobs, that you can sort of centralize assignments on things. Similarly with assets, finding equipment is just like finding work. Just activate the asset layer to find equipment, whether it's a fire extinguisher or air handler. You can quickly get access to equipment details, files, barcode info, serial numbers, documents that might go with it, whether it's a safety data sheet or manuals or procedures and things like that. All that stuff will be linked, and it's just a matter of clicking onto the location, finding those pieces of equipment and exploring from there. So it's a quick and easy way an intuitive way to find equipment without any sort of cumbersome searches. You just go to the floor you want, click on a room, and there you go. Keeping them updated is another thing. So once your drawings are in here, you don't have to go back to us if you want to make changes to how stuff is mapped to your locations in the work sub. You can simply use some of our tools to say, okay, this is room 106, this is room 108. If it's a new location that's not in the work sub, you can add it on the fly. If this was missed in the initial implementation or import, you can add it on the fly. You don't have to keep coming back to us. You can if that's how you want to do it, but we want to make sure that you've got the tools to quickly react. And as long as you can draw a box, not every room is square, so it's not always going to be a rectangle or square. There's other tools that allow you to do more free form for some of those oddly shaped rooms. Like you can see my generator room there is kind of oddly shaped. The other big thing that we wanted to accomplish is not only do we want to give you sort of the architectural floor plan so you can find your way around the building, but we want to make sure you get access to all those other data points that are around your life safety drawings. If you wanted to see smoke partitions, fire rated walls, exit, gas shutoffs, these can all be additional layers that just through logging into the work sub and clicking on the space management app, you can just activate these in a single click and zoom and pan around to find different elements, whether it's part of your statement of conditions or life safety drawings. You can get access to all of those here on your drawing. And we make it simple for whether you're a manager or technician. Through permissions, we can give people access to this functionality so they could see those different drawings or those different layers quickly and easily. And this is on your desktop. It could be on a tablet or anything like that. So one of the things we talked about frequently is how is space being used and what's the square footage allocation to each. So we can turn on sort of a usage feature, and this allows us to see, by cost center, how much square footage is devoted to each use. So as you turn that on, you'll get a pie chart allocation. You can click on segments of the pie, and it'll highlight those areas for you, and you can see the square footage associated with those. It's a quick and easy way for you to get sort of a snapshot of how your space is being used and how it's being allocated. So this is an area where we're continually investing on different reportings and analytics that we can do using the drawing as sort of the visual representation for that report. So we're pretty excited about this part. One of the other huge areas that we see is this as a workflow tool. So not only are your technicians getting assigned work and using the Works Hub as their to-do list, essentially, of all their jobs that are assigned, but we can embed the drawings directly into their work list. So they can quickly see these drawings on their assignment list, click through to see exactly where the work takes place. They can see other work orders around there if they want to jump on that work order too, or pick that one out of the queue because they're going to be in that area. They can see that as well. They can drill through to get asset information while they're on that drawing of nearby assets. They can even turn on those various life safety layers if they need to see med gas shutoffs and things like that. All of that stuff can be presented embedded in their existing workflow tools, so they don't need to learn something new. They're already navigating through a list of work orders. Now it's enhanced by embedding these drawings, giving them access to other stuff nearby in a visual way. This is something on desktop and mobile that really streamlines their workflow and helps people be most efficient without having to return for new assignments or getting work orders that are scattered around the facility. They can keep them close so people are most efficient when they're routing around for their work. So the Works Hub is a suite that's got a lot of different applications for senior living. It's got a lot of different applications for healthcare and hospital environments. Space management is one of the new ones that lands in that hub. So in these different hubs that you see here for healthcare and senior living, space management is another new item there. We've also got energy management. This helps you analyze your utility usage and make better decisions around energy consumption. So those are new things that are in the Works Hub that you can leverage as well. And I think, Zach, we've got a poll that we want to go through next just to see if people want more information about things before we get into Q&A.
Yes, we do. And I just launched it.
So
guys, if you would like more information on anything that Kyle spoke about in regards to space management, the specific module that lives within the Works Hub, if you would like more information about anything that you saw on the former slide in regards to the Works Hub, whether it be capital planning, maintenance, room bookings, any of those additional modules, click on that. And then if you would like to learn more about our energy management platform, Energy Manager, please click that.
So I know there's been a few questions coming in. We want to leave a lot of room at the end for questions because typically this is one of the more important parts. So I think we can get possibly into the QA portion and hear what people are asking, and we can field those questions where necessary. Zach, did we get any questions coming in?
Yes, we did, Kyle. So I'll go ahead and leave this poll open, and I will go ahead and ask the first question. So say someone on the line is interested, Kyle, how long do you think it would take them to get up and running on space management?
So it's a tricky question because we know that the first step is to get your hands on all the different artifacts that you've got. So let's say you've got your drawings accessible in some sort of digital format. Once we get access to those drawings, it's probably a couple weeks before you're live. We'll typically need someone at your end to help us sort of interpret those drawings and field a couple questions about them. But usually the process is getting them uploaded and marrying them to your existing, if you're already using the Works Hub, marrying them to your existing location hierarchy. As soon as we go through that process, immediately you're starting to see your work orders lay out on the map, assets start to show up on the map. It embeds sort of the map into people's to-do lists and workflows and dashboards. So it's usually a couple of weeks. That can take longer depending on how much work we need to do to go through to get those drawings in there. But it's pretty quick and painless. And in these initial early days of the system, we're going to handle most of that for you as part of a service when you buy the system. In the future, we'll have more self-service options because it is pretty straightforward.
Awesome. So Kyle, had another question come in regards to the ability to manipulate some of the drawings. So Sarah asked the question, would we be able to add layers to the pictures, or is that something that we would do as part of the implementation and setup?
So
she says, she adds on, I'm interested to be able to manipulate our drawings to some degree.
Right. So this is a good question, and there's multiple parts to this. So implementations, we've often seen that because most of our clients have full-time jobs and then some, requiring them to implement software and go through these steps to get stuff live can cause things to take a long time. So initially what we do is we'll take your drawing data and we'll do that for you as part of the implementation service. We don't have to though. So after the fact, once you're live, if you've got an additional layer that you want to create and upload, functionality is there. There's just an option for add new layer. You upload your new file. We'll consult with you a bit and give you some tips and tricks around that, but you've got control over that. As far as manipulating the drawings, there's other functionality that we're working on to help you do that as well. So let's say you wanted to, you're doing a remodel and a section of a wing is going to be changing. We don't have amazing tools yet in the system, but they're coming soon to allow you to sort of upload a revised file and keep all of your existing data in place and just sort of make easy changes. As far as adding layers to things, that part's pretty straightforward. As long as you can create an image file and you want to upload it, we can allow for additional layers, unlimited layers, in fact, that you can add on top of things. And if you want to change a layer, you can remove it and re-add it. There's a lot of different options there, and it'll be improving and changing and being enhanced in the future as we see how people are going to want to use it. So short story, yeah, you can manipulate your drawings. Long story, it'll be a lot easier in the future to do more radical things with it.
Awesome. So this question is more probably in line for John and Scott. So John and Scott, whenever you guys are fully up and running, how do you all plan on raising awareness to your staff about this space management module? And not only your staff, so your care staff, but also your technicians. So what do you guys plan on doing as far as training and rolling it out to the organization?
Well, for our in-house staff, we have monthly meetings for all the maintenance techs. And we, one of our subjects is WorkSub, so we can always keep it up to date. And they're always informed on what's going on, and this way it'll give them a little bit more tool to work with. As to staff members, we have an online demo that they take so they can put in work orders. It makes it a lot easier. It's just something we'll add into the tutorial we have for staff.
Great, that's a great idea.
Awesome. Well, cool. Kyle, I've got a number of other questions. So I had a question come in regards to what, I guess, can space management visualize? The question is, can you include a map of your property or just buildings right now?
That is a good question. So we support something that we're calling a campus map. And think of a campus map. A lot of you will have a campus map already that shows sort of your property as a whole with all your different buildings on there. So I didn't mention that, but that's something that you can upload, is that campus map. If you don't have one, a Google map, screenshot of a Google map will work. If you have an aerial shot of your property, that works too. We can upload those. And essentially what we do, when you upload something, you say it's a campus map, it serves as sort of navigation to access your drawings. So you can look at this campus map and say, okay, let's click the Weatherly building, and you click on that building and it takes you to all the drawings. You might have 4 different drawings for that building for the 4 different floors. So it serves as a navigation tool to allow you to visually start from the campus map and click all the way down to a room. So that's a good question. So we will support seeing the property as a whole through what we call a campus map.
Awesome. Cool. So Kyle, I know that you mentioned the beta program kind of in the middle of the presentation. Had a question come in and more of a comment that someone would like to be involved in the beta program. Could you talk a little bit about how someone might go about expressing interest? And I know there's no formal process, but could you just talk about that a little bit?
And that's the process in a nutshell. Raise your hand, say I want to be part of beta program. We'll put you on a list. It might not always work out. Sometimes we already have enough people. Let's say we're launching a new product and we have 10 people already. That's a lot to manage, that many people. So having another one might not be easy enough for us, but we're always looking for people who are there, who are willing, who've raised their hand, because we're always working on new things. And maybe it won't be a beta per se where you get access to new software early, but maybe you'll get access to new prototypes, and we want to leverage you to say, is the way we're redesigning this better? Does this solve your problems in a better way? But as far as getting on the program, reach out to anyone at Dude Solutions that you're connected with. It could be support, it could be your implementation manager, it could be your sales rep or account executive, it could be me. Anybody, we'll put you on the list and we'll reach out to you when we've got something that we think fits. And then once we've sort of talked through what we want to beta, then there's more of a formalized thing that we talk through of here's what the beta program is, here's what you get out of it. There's a time commitment obviously that goes with it. And it's not always easy. Beta programs are necessarily rough. You're going to get more raw software from us at that point, but it's very important to us in shaping how we do things. So yeah, just raise your hand, talk to anybody at Dude. They'll ping me and I'll get you on a list, and then we'll connect and go through the next steps from there.
Awesome. Thanks, Kyle. So I had a question come in regards to room bookings, and I guess this would be more of a future vision for space management. So
Right.
Is there any ability right now to create a room setup diagram for room bookings?
So
I guess this would be more drilling into the actual spaces that make up the whole floor plan.
right. So initially, the first foray into space management was sort of tied directly to your maintenance operations or house or work order, or anything to do with work orders. The hub is a big application. There's a lot of different apps, and room bookings is one of them. So out there on our roadmap next is to address the integration of space management with some of these other apps, room booking being one of them. So to visually look at all your bookable rooms, to create different room setup configurations and understanding what fits based on the square footage of that room. So that's going to be coming in the future. It's not there now, but room bookings is one. We also have a security application for managing your security officers and the different rounds that they do. We're going to be integrating back to that so that you can see your rounds visually on the drawing as well, to help your security staff navigate the different checkpoints they need to go to. So there's a lot of work still to do on integrating this out with the other applications, but it's on our radar. It's something that we're working on. So short answer is no, we don't have functionality. Longer answer is we're working on it. We're aware of it.
Awesome. So last question for you, Kyle, and just before I jump into this, space management is available to be demoed and to express interest in pricing and to be implemented already. So if you are interested, again, feel free to fill out the poll question and we'll have someone reach out to you. But the last question we'll take, Kyle, is can you include the utilities on your site map in relation to space management? So could you map your gas lines, your water lines, your sewer lines, et cetera?
So yes, you can. So assuming you've got some sort of existing drawing or information that shows where those are, we can upload those in a couple ways. It could be a separate drawing that just shows those, or they could be layers on top of an existing drawing. So if you do have that information, typically through the initial phase of sort of consulting and onboarding, we'll take a look at that data and assess how we're going to leverage it. But the answer is yeah, we can support that stuff visually on the drawing if we need to, and that ideally I'd want it set up as a layer that you could turn off and on for people, and we could work with you to configure it that way.
Awesome. Well, good deal. That brings us very close to time. Guys, if there were anything else that you all would like to leave us with, Kyle, Scott, or John?
So one of the other things that I just wanted to mention, because I saw one of the other questions in there about pricing. So pricing on this, it's an add-on module. We have certain discounts in place now for the remainder of the year. If you act now, sort of thing, you'll get a discount on stuff. Pricing is going to be based on square footage or number of resident units if you're senior living, based on your size. So we can follow up with you on that, get you quotes and get you on a demo and a discovery call. So if you're interested in it, if you filled out the poll to say you're interested, we'll contact you. If you said you weren't interested and you've changed your mind, just reach out to somebody at Dude. And we'll get you hooked up. But that's all I got for now.
Awesome. Thanks so much, Kyle. Appreciate you all hopping on. John and Scott, thanks so much for your insight from First Health's perspective. Really appreciate you guys being a part of not only the beta program, but today's webinar. Last but not least, Kyle, if you would just flip forward one slide. If anyone has any questions or anything further to discuss, please feel free to reach out to us. We've attached an email. We've got our phone number. Please always don't hesitate to reach out to client support or your sales rep or your client success manager if you have any questions. We'll get them handled. Thanks so much, and we look forward to talking to you guys soon. Bye now.
Thank you. Bye.
Hey, all set.
Right.
Thank you.